Hi, I am Patrick Mazi. I'm a physician at Washington University in St. Louis. I'm an assistant professor of medicine, specializing in both infectious disease and critical care, or ICU medicine. And my clinical interest and my research interest is in fungal infections. I'm also part of the folks who work with my care and bringing that to patients with fungal infections across the country and the world. One of the things that we'd like to, talk about specifically is some of the issues that come with diagnosing fungal infections and then obtaining treatment of fungal infections. And so, starting with the diagnosis of fungal infections, is that many people who eventually find out that they have a fungal infection have lots of interactions with the medical community where their fungal infection is missed. And so, what those of us that do a lot of work with fungal infections is we say they're the rarest, or they're the most common rare disease that you'll ever see. And so, individually, the specific types of fungal infections from aspergillosis or histoplasmosis or cryptococcosis, individually, they're kind of not super common. But if you group them all together, they're the most common rare diseases that you'll see. And so, the biggest barrier to delaying to making the diagnosis, or the biggest thing that causes delays in the diagnosis, is just people have to think about it. And so one of the ways that patients can sort of help their providers is, if you have that cough, that the pneumonia that you can't quite kick, you may get a course of antibiotics, but it's really uncommon for antibiotics to fail. And so if we find that we're going back to our providers and we're doing the same thing over and over and over again, that would be an opportunity to be like, we've already done a course of antibiotics in the course of this. Could anything else be possible? And so I think that, bringing up that, hey, here's a point where we're just going to have a quick pause, consider alternative diagnoses, and then once we have that pause, it's a lot easier to sort of expand the list of potential diagnoses that we could have, and then to initiate testing. So that's barrier number one. The second barrier is our fungal diagnostic testing is not very good. So it's kind of interesting that even though they're tend to be small, is that fungal organisms are more closely related, evolutionarily speaking, to people and mammals and animals than they are to bacteria. Because of that, we share many similar structures and proteins and things that are on the surface of our cells. And so to have a diagnostic test that picks up only the fungus, but not sort of the similarities with human cells, is hard. And then the fungus itself is that there's lots and lots of cross reactivity. That sort of a positive in one fungal diagnostic can occur even if you don't have that. So, back to the different types, if you have aspergillosis, the test that we order is a galactomannan, which is a part of the cell wall of the fungus. Also, if we're sending the test for histoplasmosis, even though we call it a urine antigen, it's actually the galactomannan component of that different organism. So we're looking for galactomannan, whether we're looking for aspergillus or histoplasma. And so the interpretation becomes really difficult. That being said, if we can just get people to order the test, then sort of your primary care doctor, or one of your other doctors on your care team can reach out to an infectious disease doctor like myself, or even hopefully a clinical mycologist or someone who works with fungal infections, and let us sort of practice our expertise and sort of help people interpret these tests. And so I think, again, for patients, just saying, hey, we've already done a round of antibiotics or 2 rounds of antibiotics. Is there anything else? And so, again, it's that diagnostic pause, give us just the opportunity to sort of consider other options. And I think that ultimately, that's going to help people get diagnosed earlier and then start their antifungal treatment to ultimately get cured and start feeling better more rapidly.